Hello dear friends, welcome to PharmaGrid. So today we are going to continue with the autonomic nervous system related question discussion. So question number 31. Urine determinations of catecholamines and their metabolites are useful in the diagnosis of. The options are pheochromocytoma, myasthenia gravis, goiter, osteoporosis. So here the correct answer is option A, that is pheochromocytoma. These catecholamines and its orthomethylated metabolites in urine are useful biomarkers for diagnosis of pheochromocytoma and paraganglioma. Pheochromocytomas are a tumor arising from chromaffin cells of the adrenal medulla. About 15 to 20% of such tumors are extra-adrenal in origin and is termed as paraganglioma or extra-adrenal pheochromocytoma. Both these forms have similar clinical symptoms and are characterized by secretion of catecholamines in high quantity. Sympathomimetic drugs on long-term use causes. The options are hypertension, hypotension, vomiting, anemia. We know that the sympathomimetic drugs are the drugs that are acting on the sympathetic nervous system, or they are also known as adrenergic drugs. Here the correct answer is option A, that is hypertension. Prolonged sympathomimetic drug use can induce hypertension, hyperthermia, myocardial infarction, cardiac arrhythmia, strokes, and even dissections of thoracic and mesenteric blood vessels. In addition, intravenous use of these agents also may lead to endocarditis. Prolonged or excessive use of sympathomimetic drugs can pose additional risks. These may include tolerance and dependence, that is, the continued use of sympathomimetics can lead to reduced effectiveness over time, requiring higher doses to achieve the same effects. This is what is known as tolerance. Then cardiovascular problems. Excessive sympathetic stimulation can put strain on the heart, leading to increased risk of high blood pressure, heart attacks, and arrhythmias. Then mental health issues including chronic abuse of sympathomimetics can contribute to the development of anxiety disorders, paranoia, and mood disturbances. Next question. Sympathetic ganglia are located near to. The options are spinal cord, peripheral nerves, organs they innervate, vagus nerve. Here the correct answer is option A, that is spinal cord. Autonomic ganglia can be classified as either sympathetic ganglia and parasympathetic ganglia. Sympathetic ganglia deliver information to the body about stress and impending danger and are responsible for the familiar fight or flight response. They contain approximately 20,000 to 30,000 nerve cell bodies and are located close to and on either side of the spinal cord in long chains. Coming to the parasympathetic ganglia, they are the autonomic ganglia of the parasympathetic nervous system. Most are small terminal ganglia or intramural ganglia, so named because they lie near or within the organs they innervate. The exceptions are the four-paired parasympathetic ganglia of the head and the neck. So the sympathetic ganglia located near to the spinal cord, whereas the parasympathetic ganglia located or lie near or within the organs they innervate. Which of the following best describes hexamethonium? The options are phosphodiesterase inhibitor, short-acting depolarizing skeletal muscle relaxant, dopaminergic agonist, NMDA receptor antagonist. Here the correct answer is option B, that is hexamethonium is a short-acting depolarizing skeletal muscle relaxant. Succinylcholine chloride is an analog of acetylcholine. It is an ultra-short-acting depolarizing type skeletal muscle relaxant for intravenous and intramuscular administration. It is the only depolarizing neuromuscular blocking drug in clinical practice. It is the most rapidly acting neuromuscular blocking drug and following intravenous injection exerts maximum block within a minute and lasts for less than 10 minutes. Problems associated with its use are dysrhythmias, hyperkalemia, muscle pain, malignant hyperthermia, and prolonged blockade in patients with plasma cholinesterase deficiency. Succinylcholine should be taken with caution in patients taking which of the following medication? The options are phospholinamide, prazosin, pantoprazole, adrenaline. Here the correct answer is option A, that is phospholinamide. Succinylcholine should be administered only with great caution, if at all, prior to or during general anesthesia to patients receiving anticholinesterase medication because of possible respiratory or cardiovascular collapse. So in the options we have seen phospholinamide. It is an anticholinesterase medication. So caution should be observed in treating glaucoma with ecothiopate iodide. It is also known as phospholinamide in patients who are at the same time undergoing treatment with systemic anticholinesterase medications for myasthenia gravis because of possible adverse additive effects. Exposure to neurotoxic insecticides or weed killers, anti-malarial or anti-cancer agents, then MAO inhibitors, that is the monoamine oxidase inhibitors, the contraceptive pills, then pancuronium, chlorpromazine ecothiopate or neostigmine may result in low levels of pseudocholine esterase. So suxamethonium should be administered with extreme caution and in reduced doses in such patients. If low pseudocholine esterase concentration is suspected, slow administration of a small test dose of suxamethonium, that is 5 to 10 mg as 0.1% solution should be considered. Which of the following medications can be used for the treatment of pheochromocytoma? The options are phenoxybenzamine, then alpha blockers, beta blockers, all of the above. Here the correct answer is option D, that is all of the above. Pheochromocytoma is a tumor of the adrenal gland that causes excess release of epinephrine and norepinephrine. These are the hormones that regulate heart rate and blood pressure. They are also known as catecholamines. If left untreated, pheochromocytoma may lead to hypertensive encephalopathy, cardiomyopathy, diabetes mellitus, and even death. Therefore, adequate treatment should be pursued as soon as the correct diagnosis is established. Surgery is a primary and the only valid approach, but a pre-medication step has to be undertaken prior to the procedure. Usually, the pre-treatment begins with alpha blockers. Once suitable alpha blockade is achieved, beta blockers are used to control the heart rate. Phenoxybenzamine, it is a non-selective alpha blocker, is a drug of choice. Other drugs that can be used include doxazosine or prazosin, and this phenoxybenzamine it is administered 7 to 10 days before surgery. So all these drugs, that is the phenoxybenzamine, then alpha blockers, beta blockers, so all these drugs can be used as pre-treatment options for this pheochromocytoma. Beta blockers can be used only post-alpha blockade or only after alpha blockade. Otherwise, they cause unopposed stimulating activity of catecholamines on alpha receptors, leading to life-threatening hypertensive crisis. About 10 mg of propranolol 4 times a day is usually used for beta blockade, which is later translated to long-acting daily dose. There is also an option of using calcium channel blockers alone instead of alpha and beta blockers. This is an option in low-risk patients who have the additional benefit of not interfering with plasma metanephrine assays. Identify the drug which can be used as a diagnostic agent for pheochromocytoma. The options are edrophonium, phentolamine, yohimbine, none of the above. Here the correct answer is option B, that is phentolamine. Phentolamine is an alpha adrenergic blocker used to treat hypertensive episodes, diagnose pheochromocytoma, treat norepinephrine administration site reactions, and reverse soft tissue anesthesia and mydriasis. Which of the given statements is wrong? The options are parathione and malathione are organophosphorus compounds. Organophosphate compounds are reversible anticholinesterase agents. Pralidoxime can reactivate inhibited acetylcholinesterase. None of the above. So in the question they have asked about the wrong option or the wrong statement. So here the answer will be option B. That is, organophosphate compounds are irreversible anticholinesterase agents. Okay, they are not reversible anticholinesterase agents. These organophosphate compounds are irreversible anticholinesterase agents. Remaining all other statements are true. Which of the following medication can cross the blood-brain barrier? The options are neostigmine, pyridostigmine, physostigmine, both A and B. Here the correct answer will be option C, that is physostigmine. Physostigmine can enter and stimulate the cholinergic sites in the central nervous system. Unlike physostigmine, neostigmine has a quaternary nitrogen. Therefore, it is more polar, is absorbed poorly from the gastrointestinal tract and does not enter the central nervous system. Pyridostigmine is another cholinesterase inhibitor used in the chronic management of myasthenia gravis. Identify the correct statement about myasthenia gravis. It is an autoimmune disease in which antibodies complex with nicotinic receptors at the neuromuscular junction, resulting in destruction of nicotinic receptors. Then characterized by progressive weakness, fatigue, drooping eyelids, and difficulty in breathing, speaking, and swallowing. Then indirect acetylcholinesterase inhibitors such as neostigmine and pyridostigmine are used to increase acetylcholine levels at the neuromuscular junction to fully activate the remaining receptors and increase the strength of contraction of muscles. Next option is all of the above. So here the correct answer is option D, that is all of these statements, are true or correct regarding myasthenia gravis. Which of the following drugs could theoretically improve asthma symptoms? The options include bethanechol, pilocarpine, pyridostigmine, atropine. Here the correct answer is option D, that is atropine. This atropine is an anti-muscarinic agent or it is an anticholinergic drug. Muscarinic agonists and drugs that increase acetylcholine levels cause constriction of the bronchial smooth muscles and could exacerbate asthma symptoms. Bethanacol and pilocarpine are muscarinic agonists, and pyridostigmine is a cholinesterase inhibitor that increases the levels of acetylcholine. Okay, so these drugs cannot be used or they could worsen or exacerbate the asthma symptoms. But this atropine is a muscarinic antagonist and therefore does not exacerbate asthma. Theoretically, it should relieve symptoms of asthma, not used clinically for this purpose. A patient who had received a non-depolarizing neuromuscular blocker for skeletal muscle relaxation during surgery is experiencing mild skeletal muscle paralysis after the surgery. Which drug could reverse this effect of neuromuscular blockers? The options are pilocarpine, bethanacol, neostigmine, atropine. Here the correct answer is option C, that is neostigmine. Neuromuscular blockers act by blocking nicotinic receptors on the skeletal muscles. Increasing the levels of acetylcholine in the neuromuscular junctions can reverse the effects of neuromuscular blockers. Therefore, neostigmine, a cholinesterase inhibitor, could reverse the effects of neuromuscular blockers. Pilocarpine and bethanacol are preferentially muscarinic agonists and have no effects on the nicotinic receptors. Then atropine is a muscarinic antagonist and has no effects on the nicotinic receptors. Hence came the answer neostigmine, which is a drug that can be used to reverse the effects of neuromuscular blockers. A 50-year-old male who is non-compliant with medications was recently diagnosed with chronic obstructive pulmonary disease. His physician would like to prescribe an inhaled anticholinergic that is dosed once or twice daily. Which drug is most appropriate for this patient? The options are atropine, ipratropium, tiotropium, trospium. Here the correct answer is option C, that is tiotropium. The physician should prescribe a long-acting muscarinic antagonist so that the patient has to inhale the medication only 1 or 2 times daily. Tiotropium is a long-acting muscarinic antagonist, whereas ipratropium is a short-acting muscarinic antagonist. Atropine and trospium are muscarinic antagonists but are not indicated for pulmonary conditions such as asthma or COPD and are not available as inhaled formulations. An elderly patient is brought to the emergency room with a blood pressure of 76/60 mmHg, tachycardia and low cardiac output. He is diagnosed with acute heart failure. Which of the following drugs is most appropriate to improve his cardiac function? The options are epinephrine, phenoldopam, dobutamine, isoproterenol. Here the correct answer is option C, that is dobutamine. Among the choices, the ideal drug to increase contractility in acute heart failure is dobutamine since it is a selective beta-1 adrenergic agonist. Phenoldopam is a dopamine agonist used to treat severe hypertension. The other drugs are non-selective adrenergic agonists that could cause unwanted side effects. Which neuromuscular blocker is most commonly used in electroconvulsive therapy? The options are rocuronium, succinylcholine, cisatracurium, pancuronium. Here the correct answer is option B, that is succinylcholine. That is succinylcholine is the most commonly used neuromuscular blocker in electroconvulsive therapy. Electroconvulsive therapy is a definitive treatment for patients with psychiatric disorders that are severe, acute or refractory to pharmacologic therapy. Muscle relaxation agents are utilized in electroconvulsive therapy to prevent musculoskeletal injuries such as fractures and myalgias from the vigorous activity experienced from the seizure. Ideally, a short-term paralytic with rapid onset is used so that minimal residual paralysis is seen after the procedure. Succinylcholine is therefore the most commonly used paralytic during electroconvulsive therapy. It is a depolarizing neuromuscular blocking agent which depolarizes the motor end plate by adhering to postsynaptic cholinergic receptors, resulting in a phase 1, that is depolarizing phase, and an eventual phase 2, that is desensitizing phase block. Levoterenol is another name for. The options are epinephrine, norepinephrine, dopamine, atropine. Here the correct answer is option B, that is norepinephrine. Norepinephrine, sometimes referred to as L-artenol or levoterenol or L-norepinephrine. It is a sympathomimetic amine which differs from epinephrine by the absence of a methyl group on the nitrogen atom. Which is the most effective anti-motion sickness drug for a person planning to go on a cruise? The options are atropine, festrodin, scopolamine, tropicamide. Here the correct answer is option C, that is scopolamine. All muscarinic antagonists, that is the anticholinergic drugs listed above, are theoretically useful as anti-motion sickness drugs. However, scopolamine is the most effective in preventing motion sickness. Tropicamide mostly has ophthalmic uses and festrodin is used for overactive bladder. A 70-year-old male is treated with doxycycline for overflow incontinence due to his enlarged prostate. He complains of dizzy spells while getting up from bed at night. Which drug would you suggest as an alternative that may not cause dizziness? The options are propranolol, phentolamine, tamsulosin, terazosin. Here the correct answer is option C, that is tamsulosin. Dizziness in this elderly patient could be due to orthostatic hypotension caused by doxycycline. Tamsulosin is an alpha-1 antagonist that is more selective to the alpha-1 receptor subtype, that is alpha-1A, present in the prostate, and less effective to the alpha-1B subtype. This alpha-1B is present in the blood vessels. Therefore, tamsulosin should not affect the blood pressure significantly and may not cause dizziness. Okay, so this tamsulosin is more selective to alpha-1A receptor subtype located in the prostate. Terazosin and phentolamine antagonize both these subtypes and cause significant hypotension as a side effect. Propranolol is a non-selective beta blocker that is not indicated in overflow incontinence. Hence came the correct answer as tamsulosin. A 60-year-old female who had a cancerous growth in the neck region underwent radiation therapy. Her salivary secretion was reduced due to radiation and she suffers from dry mouth. Dry mouth is also known as xerostomia. Which drug would be most useful in treating xerostomia in this patient? The options are acetylcholine, pilocarpine, ecothiopate, atropine. Here the correct answer is option B, that is pilocarpine. Salivary secretion may be enhanced by activating muscarinic receptors in the salivary glands. This can be achieved in theory by using a muscarinic agonist or an anticholinesterase agent. Pilocarpine is a muscarinic agonist administered orally for this purpose. Acetylcholine has similar effects as that of pilocarpine. However, it cannot be used therapeutically as it is rapidly destroyed by cholinesterase in the body. Ecothiopate is an irreversible cholinesterase inhibitor, but it cannot be used therapeutically because of its toxic effects. Atropine is a muscarinic antagonist and worsens dry mouth. Which drug is useful in treating sinus bradycardia? The options are atropine, cisatracurium, neostigmine, succinylcholine. Here the correct answer is option A, that is atropine. Sinus bradycardia is a condition where the heart rate is below normal and most often caused by increased vagal tone, that is due to the increased release of acetylcholine in the sinoatrial node, that is the SA node, that acts on the muscarinic receptors to reduce the heart rate. A muscarinic antagonist such as atropine is useful in this situation to bring the heart rate back to normal. Succinylcholine and cisatracurium are nicotinic antagonists and have no effect on muscarinic receptors in the SA node. Neostigmine is a cholinesterase inhibitor and can worsen bradycardia by increasing the level of acetylcholine in the SA node. Normal adult dose of atropine is, the options are 5 to 10 mg, 0.4 to 2 mg, 1 to 2 gram, 15 to 20 mg. Here the correct answer is option B, that is normal adult dose of atropine is 0.4 to 2 mg. Usual adult dosage of atropine. Anti-sialagogue or for antivagal effects, initial single dose of 0.5 mg to 1 mg. As an antidote for organophosphorus or muscarinic mushroom poisoning, initial single dose of 2 mg to 3 mg repeated every 20 to 30 minutes. Then bradysystolic cardiac arrest, 1 mg dose repeated every 3 to 5 minutes if asystole persists. Then patients with coronary artery disease, limit the total dose to 0.03 mg per kilogram to 0.04 mg per kilogram. A 40-year-old male presents to his family physician with drooping eyelids, difficulty chewing and swallowing, and muscle fatigue even on mild exertion. Which agent could be used to diagnose myasthenia gravis in this patient? The options are atropine, edrophonium, pralidoxime, ecothiopate. Here the correct answer is option B, that is edrophonium. The function of nicotinic receptors in skeletal muscles is diminished in myasthenia gravis due to the development of antibodies to nicotinic receptors. This myasthenia gravis is an autoimmune disease. Any drug that increases the levels of acetylcholine in the neuromuscular junction can improve symptoms in myasthenia gravis. Thus, edrophonium, which is a reversible cholinesterase inhibitor with a short duration of action, can temporarily improve skeletal muscle weakness in myasthenia gravis, serving as a diagnostic tool. An ICU patient with severe lung injury requires a neuromuscular blocking agent to assist in his ventilator management. He has liver disease and is currently in renal failure. Which neuromuscular blocker is the best choice for this patient? The options are cisatracurium, pancuronium, vicuronium, rocuronium. Here the correct answer is option A, that is cisatracurium. Pancuronium is renally eliminated and the patient has renal failure. Vicuronium and rocuronium are hepatically metabolized and the patient has liver disease. So here the correct option is cisatracurium. Cisatracurium is cleared by organ independent metabolism. It is known as Hoffman elimination. Which of the following statements are true about demicarium? The options are long-acting cholinesterase inhibitor and a potent miotic, indirect-acting parasympathomimetic agent, used for the topical treatment of chronic open-angle glaucoma, all of the above. Here the correct answer is option D, that is all of the above. Demicarium is an indirect-acting parasympathomimetic agent that is used to treat glaucoma. It is a cholinesterase inhibitor or an anticholinesterase. Because of its toxicity, it should be reserved for use in patients with open-angle glaucoma or other chronic glaucomas not satisfactorily controlled with the short-acting miotics and other agents. What drug is used to treat malignant hyperthermia? The options are dantrolene, atropine, lithium, prazosin. Here the correct answer is option A, that is dantrolene. Dantrolene is a drug used to treat malignant hyperthermia. Malignant hyperthermia is a hereditary disorder of skeletal muscle that classically presents as a hypermetabolic response to halogenated anesthetic gases and or the depolarizing muscle relaxant succinylcholine. Genetically susceptible patients can have a malignant hyperthermia reaction in response to triggering agents such as halogenated anesthetic gases and or succinylcholine, and more rarely to stressors such as vigorous exercise and heat exposure. Dantrolene is classified as a direct-acting skeletal muscle relaxant. Dantrolene works by inhibiting calcium ion release from the sarcoplasmic reticulum. Its mechanism of action is through antagonizing the ryanodine receptors, which lessens the excitation contraction coupling of muscle cells. Dantrolene is currently the only specific medication used for treating a malignant hyperthermia crisis. Cholinergic crisis may occur in which of the following conditions? The options are myasthenia gravis, Alzheimer's disease, goiter, depression. Here the correct answer is option A, that is myasthenia gravis. Cholinergic crisis is a clinical condition that develops as a result of overstimulation of nicotinic and muscarinic receptors at the neuromuscular junctions and synapses. This is usually secondary to the inactivation or inhibition of acetylcholine esterase, the enzyme responsible for the degradation of acetylcholine. Excessive accumulation of acetylcholine at the neuromuscular junctions and synapses causes symptoms of both muscarinic and nicotinic toxicity. These include cramps, increased salivation, lacrimation, muscle weakness, paralysis, muscular fasciculation, diarrhea, and blurry vision. One of the treatment modalities for myasthenia gravis is the use of acetylcholinesterase inhibitors such as pyridostigmine. This acetylcholinesterase inhibitors prevents the breakdown of acetylcholine by inactivating acetylcholinesterase. This stops the breakdown of acetylcholine and increases its level and duration of action at the postsynaptic membrane. Excessive use of acetylcholinesterase inhibitors in the treatment of a patient with myasthenia gravis may precipitate a cholinergic crisis which is characterized by both muscarinic and nicotinic toxicity. In clinical practice, cholinergic crisis is most commonly seen in patients with myasthenia gravis on treatment with high-dose acetylcholinesterase inhibitors, patients after general anesthesia who received high-doses acetylcholinesterase inhibitors to reverse the effects of neuromuscular blocking agents, for example neostigmine, then exposure to a chemical substance that causes inactivation of acetylcholinesterase. Examples of such substances are nerve gases like sarin, tabun, soman, and other organophosphates like pesticides and insecticides. Adrenaline is metabolized by which enzyme? The options are monoamine oxidase, catechol orthomethyl transferase, acetylcholinesterase, both A and B. Here the correct answer is option D, that is both A and B. Epinephrine, also known as adrenaline, is rapidly metabolized by monoamine oxidase and catechol orthomethyl transferase, and the metabolites metanephrine and vinyl mentilic acid are excreted in urine. Bethanacol is similar in action to. The options are atropine, acetylcholine, metoprolol, prazosin. Here the correct answer is option B, that is acetylcholine. As a cholinergic agent, bethanacol is similar in structure and pharmacological function to acetylcholine and is used in specific cases when stimulation of the parasympathetic nervous system is necessary. For example, bethanacol is readily used to treat post-operative or postpartum urinary retention. An advantage of bethanacol is that, in contrast to acetylcholine, bethanacol is not degraded by cholinesterase, allowing its effects to be longer lasting. Which among the following is a hydrophilic beta blocker? The options are atenolol, propranolol, metoprolol, all of the above. Here the correct answer is option A, that is atenolol. Beta blockers may be divided into lipophilic or hydrophilic drugs according to their distribution coefficient. Beta blockers with high lipid solubility include metoprolol, propranolol and timolol. Atenolol is an example of a beta blocker with a lower lipid solubility. It is a hydrophilic beta blocker. Hydrophilic beta blockers like atenolol are advantageous in patients who suffer from central nervous side effects during therapy with lipophilic drugs such as sleep disturbances, psychosis, depression, hallucination. Identify the adverse effect which is not associated with a neostigmine. The options are salivation, diarrhea, decreased blood pressure, bronchodilation. Here the correct answer is option D, that is bronchodilation. A potentially life-threatening adverse effect of neostigmine is bronchoconstriction. Neostigmine, along with other anticholinesterase inhibitors, can stimulate the muscarinic receptors in the airway smooth muscle, potentially leading to bronchospasm. This adverse effect can be mostly attenuated with concurrent administration of an anticholinergic agent like glycopyrrolate. Other adverse effects include increased secretions, meiosis, nausea, and increased peristalsis. So in the question they have asked about the adverse effect which is not associated with the neostigmine. So here the answer will be option D, that is bronchodilation. This neostigmine often causes bronchoconstriction. So with this question we have completed the question discussion related to autonomic nervous system. So thank you for watching this video. Have a great day.